In Kenya, more women than men die of cancer. These numbers are 18,772 women and 14,215 men. These are just numbers, but they are parents, they are somebody's child somewhere. And on this show, we'll focus on the children who've lost their parents to cancer. They say that many cancer cases in Kenya are due to a change in lifestyle, a more sedentary lifestyle, or even the food we eat, more junk food, or even the hot beverages, the hot teas that we take. Is this what is causing the cancer? Is this the reason for the high numbers that are denying children of their parents? On Health Digest, that is what we focus on your authoritative health show. I'm Dr. Mercy Korir. And to start off this discussion is this short story by Caroline B.
Cancer is among the leading causes of death in children aged between 1 to 19 years. The most common categories of childhood cancers include leukemia, brain cancers, lymphomas, and tumors. Unlike in adults, most childhood cancers do not have an identified cause, and spotting it can be very difficult because symptoms are often shared among various illnesses.
But we have symptoms that are rather obvious, symptoms like an unusual lump or swelling. It could be anywhere. It could be on the belly, that could signify a kidney tumor going on. It could be in the muscle, that is a soft tissue sarcoma.
Certain prolonged infections like malaria and HIV could increase the risk of child cancer. Parents are therefore encouraged to take their children for regular checkups to increase chances of early diagnosis. Since it is not possible to prevent child cancer, the best strategy is getting ahead of it by securing an early diagnosis, paving the way for specific treatment and palliative care that is required. However, the lack of a child cancer hospital is another challenge hampering treatment.
Most childhood cancers are curable. Okay? So in adults, it depends mostly on the stage, like I said. Once it spreads, it becomes a bit difficult to contain. But in kids, there's really high hope. And that is why that should be the focus of our attention, because no child should die from cancer. I mean, children are already a vulnerable population. We know that, right? Then a child with cancer, that is like double vulnerability. Understand? So we should focus our efforts towards trying to find the best treatment approaches for children. Set up a pediatric cancer center in Kenya. There's no pediatric cancer hospital right now.
The loss of a child to cancer or any other reason is devastating for families, and parents have to map out healthy ways of grieving. Counselors encourage parents to celebrate and have a relationship with their children after they die.
We have the option of support groups. We have support groups for for parents who've lost their children to cancer. And usually these parents meet, they share experiences with other parents who understand the grief. And usually it helps to offer hope to this group of people.
They are also advised to open up about the issue and lean on someone. Caroline B., KTN News.
Cancer is definitely a burden, as we have seen. And among those people that have been affected by cancer are children who've lost parents, whether at a tender age or in their adult life. Either way, they are children who've lost their parents, and this is the conversation that we'll be having on Health Digest. With me on this conversation is Edith Mwai, Natasha Kiboi, and Nancy Njeri, all at various stages have lost their parents, and we'll get to hear from them. We'd like to hear from you. If you'd like to get in touch with us, you can tweet me at Dr. Mercy Korir, at KTN News KE, or you can drop us an email at healthdigest@standardmedia.co.ke. We'd like to hear from you on this conversation that we've started on the burden of cancer and the psychological toll that it has on us as a society. And to start off this conversation, I'd like to start with Edith, and just to hear about your journey and how it has been like.
Thank you, Daktari. My journey, my dad was diagnosed with cancer in 2015. But I can't say it's 2015 because it was a misdiagnosis, and because What they did is that they found he had a mass in his stomach. Then they did a procedure which up to date I've never understood, because they said they were tying up one of the kidneys because it was the one which had cancer cells. And after that, the mass started decreasing, though he didn't do chemo or anything else. And the whole lot of 2016, he was okay after that bypass thing. I don't know what it's called. And in 2017, early 2017, he started feeling pain again in his stomach, and he started coughing. And when he was coughing, he started coughing out blood. So that was a case for concern. Went back to the hospital. And what I forgot to say is that during the whole lot of 2016, he had his visits to the doctor every month. Every month with a consultation fee of 5,000, more scans, more CT scans, and other tests that cost a lot. And all these tests didn't show that he had cancer of the lungs and of the chest. But in 2017, when he started feeling bad, he was admitted in a rural home, that's Nyeri. And they started treating him. Up to now, I've never understood what they were treating, because it got bad, worse than what it was before. And by 2017, December, he could not walk on his own. He was totally bedridden. And that is when I decided to ask the doctor exactly the position. I told him, because being the eldest, I needed to tell my brothers what was happening. And he told me they had put him on palliative care. He was in hospital, so. And I knew then there was no hope. So I called my brothers and told them, as we usually say in Kikuyu, that whoever is holding on to him, to let him go, because he was going through a lot of pain. And every time he'd cough, you'd see him coughing out his chest. It was traumatic, because the whole lot of 2017, I'm in Nairobi. I have my last born twins were in class 8, and had to travel every 2 days. Go to Nyeri, stay with him one day, come back to my kids, and I'm leaving them alone. There too, I was leaving them alone. The financial implication was too much, being a single mother and all, and I'm the eldest. All my other siblings were looking up to me. Kila mtu akienda nyumbani, they'll call me, sisi tutafanya nini? And I'll tell them God will do his will, because there's nothing else we can do. And so in 2017, when he was bedridden and the doctor told me it was palliative care, I called them, I told them. Again, at that time, I also asked the doctor if there was any alternative medicine, because even the morphine they were giving him was not working on him. So you'd go sit with him. Sometimes you'd spend the whole night in the hospital and see what he's going through. When he's coughing, I actually say he was coughing out his chest, because there's nothing that was left. When I told my brothers, they told me I was wishing death on Dad. They didn't want to understand. And it was a difficult time for the family, because with no money, and the doctors, every other time they came to his bed, it was all about money. Then you go to the hospital, you find even the oxygen tank is empty. You try to get somebody to change it, they're not willing. And some of these things I wouldn't even wish them on my enemy. It's a traumatic thing. And in 2018, he succumbed. And okay, hatujamaliza mwaka. It's not even a year. It's still hard for me. Since his demise, I've gone home once. I didn't even go to his grave. On Saturday, we were supposed to have a get-together and laying of the cross on his grave. And I'm not even sure I'm attending. I still need to heal. It's not an easy thing.
It is tough.
Yeah.
Natasha.
Okay, for me, my mom's journey started in late October in 2016. I was in my last year of high school, and I could talk to my mom on phone, and I knew she was okay. And then this day I asked to be picked from school, and immediately after school I'm taken to Nairobi West Hospital, where I saw my mom and I was so shocked. All I noticed was how much weight she had lost, and I couldn't help but make fun of it because she's been gymming all this time and nothing changes, but all of a sudden you're in hospital and you've lost this much weight. And she just said, seeing you here happy gives me joy and strength. And she was like, I knew you'd be strong. And then that evening, I remember going back home and hiding in a wardrobe just to cry, because I found people preparing fundraising cards, and I'm like, what is this that makes mom have to have a fundraising to go to India? And I locked myself in the wardrobe and cried my heart out. And my sister found me and explained that it's just for caution that we want to take mom to India. And thereafter, I just decided, you know what, let me just deal with this, whatever comes, sour. And I remember we used to visit daily in hospital before she was transferred to Kenyatta Hospital, where sasa we had to get like clear results, because initially we'd get results and they'd be nullified. You get other results, they're nullified. And eventually being told it was some fast-growing cancer, a really high rate. So by the time she was getting diagnosed clearly, she was at stage 4, and we had to act with immediate effect. So I remember mom flying out, she was not in a good state. Her vitals were low, so we had to wait for her to stabilize, and then she flew out. And from then I knew I was comfortable with her flying out, because I tend to think that our doctors are negligent. And every time we hear people going to India because we believe the doctors out there are better than ours. And I was confident that my mom was going to be okay. And she did. She came back with so much joy in April. And in April, during my holiday, this 2017, when I was in my last year of high school, she came back during holiday, and she was strong and happy and cured. I would say she was cured. And I remember I was the only one at home amongst my siblings, being the 3 of us, as the last one. I was the only one at home with my dad. And I remember this time she got in so much pain. And I was like, Dad, can we just have mom go to a hospital and stay there? Because there's no point of having her here and seeing her suffering. And it was just too much to bear. And I remember clearly how mom and I used to go to hospital, and she'd get her follow-up meds, and at some point it was just, I felt like they were reckless, because every time we get back home, mom has an infection from her other chemo. And I really felt betrayed by doctors from my own country. These are our people. I feel like you're not taking care of them right. This is your fellow human being, and you're being negligent over their health. It was really painful for me. Then, after going back to school, I left my mom in hospital, Nairobi West Hospital again. I left her there in quite a normal condition, a normal human being, happy, jovial. That's how my mom was. So I knew she was okay. 2 weeks down the line, I want to call back home, but I'm stopped from calling home. And I remember that afternoon, I was picked from school and was told I was going to visit my mom. But I knew where Mpisha Hospital was. So where we turned, the turn we took was not Mpisha Hospital. It was Mpisha Morgue. And then I knew I did not have a mother. And it was difficult. And I'd say after that, everything changed. I hated the system in Kenya so bad. I really don't understand how you just disappear on people. Because I remember when Mom passed on Monday morning, 5 a.m., the 15th of May, the doctor went silent on us. And Dad couldn't make contact. So Dad went to hospital and the news is given to him by a nurse. And we tried reaching the doctor. 3 days later, 4 days later, 5 days later, no response. And I don't really think that is how you break news to a patient, a person who's been taking care of a patient. There's a way to do it. There's a way to prepare someone to absorb the news that I have lost your patient. And we understand that you're not gods, that you can't do much as to help our patients, but at least be kind enough to show concern of the patient. Afterwards, my dad organized some counseling for us as siblings, and we sat together, and all the the counselor could say was, "You guys are strong." Because I feel like, however much we felt the pain of suing the doctor, which was an option, but it wasn't a proper send-off for our mother. She can't leave them and start battling for her loss. So we just let it be. And we tried to talk to Dad to just let go of the case, which he did eventually. And ever since, my family has become a group of warriors for cancer patients. And I believe sooner than later, we will have better care for our patients, and we will have less negligence from our doctors. Thank you.
Thank you. Thank you, Natasha, for your story. Nancy.
My name is Nancy, and I studied Limau, which means lemons. And it was a time when I lost my mom to breast cancer, and that was 2017. And at that time I was eating bitter lemons. She called me while I was still living in the US, and I was at work doing a sales presentation, and I get a text from her saying, "I just came from the hospital and I have breast cancer." The way she said it, I was like, I can't even text back. So I excused myself, and the moment she said she had breast cancer, I literally just saw a pink coffin just passing through my eyes. I was like, oh my God, she's gonna die. So what I did is I called her immediately, and she was screaming her head off. She'd locked herself in the bedroom. My dad was downstairs, and he said, who told you have breast cancer? She said, I went to Coptic Hospital, and now they want me to do surgery, like mastectomy, like real quick. And I said, wow. I mean, I don't know. So what I did was, she's crying on the phone, I'm crying on the phone, I don't know what to do. So I took a day off, and she was in her bedroom crying. I'm in my bedroom crying. I couldn't even process everything. I mean, I'm so far away, and if she could receive the news as a death sentence, straight up, the way she just said, wameniambia niko na cancer, niende nikatwe matiti ama nitakufa. And that was at Coptic Hospital. So it was very, very devastating. And that's when we started the journey of fighting this monster. Then later on, we're like, maybe it's not true. Maybe it's a misdiagnosis. So we sent her to Kijape Hospital. Cancer is not really new to the family. My auntie, my mom's sister, is a 15-year breast cancer survivor. So she advised that we go to Kijabe for a second opinion. So we went there and we found an amazing doctor. It's called Dr. Bard, who took my mom through the whole journey, and told her, we have patients who have been healed of cancer, and if you start your treatment, you'll be fine. But my mom refused to do chemotherapy. She said most of her friends who had cancer and they went through the treatment, they're gone. You want me to die? Here's my sister, who is a 15-year breast cancer survivor. After her mastectomy, which you did 15 years ago, she's still alive with herbal medicine. So I got into Google, started researching on cancer treatment, called a few of my friends who had parents who were ailing, and they were telling me, my parents finished all these chemos and radiation, and we still lost them. So I told my mom, let's not do the treatment in Kenya, come over to the USA, send the invitation. But then she's like, no, you're making me sleep with cancer every night. I need this breast out. So within no time, she had already scheduled her mastectomy, which was successful. But the stigma, after she lost her breast, went to the village, and all her friends were cancer survivors, but the group that she was in, it's like they were all waiting, who is dying next, because there's no hope. And they kept saying, Mom, you need a better support group. You need, are you guys talking about nutrition? Like, yeah, giving me some ugly looking fruit. This is healing cancer. She had all the wrong information. So that 1 year was really like back and forth. My dad was also hiding the information of how my mom is faring. So I came to visit in December, and she had lost so much weight. But then she was all positive, doctor says everything is looking good. She was not even going back to the doctor because doctor wanted her to do chemotherapy. She's not on that. So my journey with Lima was to make sure the patients have the right information. They have access to affordable cancer treatment, where we try and connect them with donors and anybody who can be able to waive their consultation fee. Every time she'll go visit a doctor, it's 5,000 consultation fee. And when we talk about ways of reducing this cancer treatment, they don't want to cancel. They don't want to reduce their consultation fee. Mm-hmm. So the next time I'm talking, I stayed here for 4 months, and at the airport, I remember she was wearing a dress that was a V, and they saw a swollen lump on her chest, and they said, oh my God, I think I had read about metastatic breast cancer. I think it has gone to her lungs. Then 1 month after I left, and I remember she gave me this tight hug that I didn't know why she called me back after I checked in. She called me back. I thought I had forgotten something. But she just said, I just want to give you a hug. I didn't know it was the last time I was giving her a hug. I was giving her a hug. So I flew out, and a month later, the next time she's calling me, she called the kids. The dad took them to my dad's house, and that's the night she actually passed on. She got the symptoms of lung cancer, just throwing up, and she was taken in at about 1 o'clock in the morning, and the whole day she didn't want to go to the hospital. So in Umoja, there is no cancer center. She had to be rushed to Texas, but she didn't make it. So she was taken to a local clinic, and the clinic, really, the doctors did not know anything to do with cancer care. So they just put her there, no ventilator. She's struggling to breathe. And I didn't even know she had shaved her hair because she didn't want to go through the whole chemotherapy treatment, lose her hair and all that. So now when I asked my friend to go check on her, my dad is in the village. I'm asking him, you need to come home because mom is not well. Said no, she was fine this morning. So I'm the one who was routing everybody. Get out, we need to do something because if we don't, she's gonna die. And when she was taken to the clinic, she was just resting there. Morphine is all they were giving her. And then I asked the neighbor who had rushed her to the hospital, where is the doctor? The doctor was just on WhatsApp, LOLing, while my mom was dying. And there was nothing much that was being done. And by the time my dad reached there, take her to Texas Cancer, she died in an ambulance. And on that time, I was still on the phone with her. I'm driving on a bridge when she's gasping her last breath. And I was like, Mom, will you make it? She just said, no. I said, just go with the angels. I don't know what I can do. I'm 1,000 miles away. And just a feeling of hopelessness. So she left and started the whole mourning and grieving, and that's when started Limau, which has impacted a lot of people. But we are left with a home that has now become a house. There's no happiness. There's scars of cancer that comes with it. There's no joy at home. We are still pained every day. I have to be a caregiver now to my dad, who has to live a new life without a wife, watching her waste away. And then my mom's mom was always with her, and she was 86 years old, so she couldn't take the whole depression that comes with watching her daughter die. So we lost her 7 months again. We were back to burying her mother. So it was like a year of just funerals, and still impacts me up to date. So
thank you.
It's tough.
Thank you for your stories. We'll take a short commercial break from that point, and when we come back, we'll continue with this conversation.
Comprehensive sexuality education encourages youth to engage in sexual activities. Myth. The idea of a comprehensive sexuality education is to provide young people with information about their sexuality in order for them to make informed decisions about their sexual and reproductive health. Studies have shown that sex education programs do not increase sexual activity nor lead youth to engage in them at an earlier age, but rather such programs help the youth to delay sexual initiation.